Hey, this is Dr. Michael Cuthbertson at Physio. Do you ever experience back weakness whenever you sustain an injury or feel pain in your back? One of the reasons that this happens is because the muscles that should be stabilizing your spine that connect to it turn off. I'm going to show you the best exercises to turn those muscles back on and to stabilize your spine again. Before we get started, we're going to review a few concepts that are important to understand to help us to put these exercises together and to understand what we're trying to accomplish with them. I'm going to be talking for a moment here about deep stabilizing postural muscles, more superficial or toward the surface fast twitch muscles, and then pressure gradients that are formed in our body between the pelvic floor, the diaphragm, and the epiglottis. First of all, those deep stabilizing muscles that I was talking about earlier, the three primary muscles include the psoas, which you can see represented here, that runs from the spine all the way down to the leg here. The multifidus muscles, which run from the sacrum all the way through the spine, even all the way up to the neck. And then the quadratus lumborum muscles, which run from the lower rib to the lumbar spine, the back vertebrae, and to the top of the pelvis here. Whenever we experience that inhibition or the shutting off of muscles, this is what we're referring to. These muscles shut off, and as a result, we have poor control throughout our spine and a lack of controlled movement. Additionally, when we have this happen, we can also lose the benefit of different pressure gradients throughout our body. That includes stabilization and proper function of our pelvic floor, which resides here at the bottom of our pelvis, the diaphragm, which sits right in here underneath the rib cage, which is an important muscle of breathing, and then the epiglottis. The epiglottis is that flap that closes off our airway to keep us from having food go down the larynx and trachea, and rather importantly go down the esophagus. But it has also an important stabilization component to help to stabilize the neck, the rib cage area, thoracic spine, in addition to the abdominal area. We also have muscles through this area that help to complete that pressure system in the front of the abdomen. That includes transverse abdominis muscles and oblique muscles. Whenever we have that pressure gradient benefit, we're able to move that's what keeps our body from collapsing down. That keeps our body, it creates a pressure to allow the deep muscles of the spine also to be a little bit more efficient. So when that also is inhibited or is not working, then we rely more on our fast twitch muscle fibers. These muscles might be bigger muscles that sit more superficially on the spine, or rather on the body, or more toward the skin. And those muscles are really good to help us to move. But when the other muscles shut off, they then try to take on a role of trying to stabilize the body. And they don't do a good job of that. That's one of the reasons why you feel stiff, because those muscles that are also functioning to make us move are also tightening up. And that's when you might start to experience back spasms. You might start to experience stiffness or tightness. You can barely move. So what we're going to accomplish by these exercises is rebalancing this system, getting muscles that should be doing their job deep in the spine to kick back on, pressure gradients to start to help to support our body, and then also to relax those muscles that should be helping us to move, those fast twitch muscle fibers, and getting our body to be more efficient once again. Now, when we do these exercises, you might ask yourself, how long should I do them? Well, that's going to depend on your capacity and your ability. We talked about these being activation exercises, getting the core kicked back on appropriately. The principles of stabilization of any structure in our body, but in particular in this case our core, include proper initiation strength, and endurance. Now, while we're focusing on the activation and turning muscles back on with these exercises, we don't want to neglect the importance of building strength and endurance. So when you start out, you might do them for a shorter period of time, but in time, you will be able to do them for longer, and you'll notice that your body has a better capacity to do it. So go ahead and lie down on your back. What you're going to start out doing is getting your back flattened out on the surface by tilting your pelvis. And then you're going to bring up both knees toward your shoulders. It's important that you get your pelvis lifted up off of the table. If you can't do that, I'll show you some modifications. Your ankles are going to be bent, your knees bent, and your hips bent. You're going to place pressure from your hands into your thighs and pushing into your knees as though you're trying to slide your hands up toward the ceiling. But you're going to maintain the pressure equally between your arms and your legs, and your body won't move. From here, we're going to switch the position of our hands, opposite hand and opposite knee, and then do the same thing. The third exercise, you're going to place your hands underneath in the fold of your knees. You're going to point your toes for this one, and then you pull with your arms and push away with your legs, again holding that position. And then finally, you go back to the same exercises that you started with, hands on your knees, ankles bent, knees bent, hips bent. Applying a light pressure and then gradually building that pressure over time. You'll find that you're probably going to experience some shaking at first. That's a sign that your fast twitch muscle fibers, those mover muscles, are trying to do the work of the deep stabilizers. But as this exercise takes effect, you'll notice that that shaking becomes less and your strength improves. Now, for those of you that are having a hard time lifting up the pelvis and holding that position, I'll show you a modification. For this, I'm going to use a half foam roll, but you can also use a pillow or some other device at home. You're going to place the foam roll underneath the bottom of the pelvis to help to support you in that position. And that way you can get to the proper position, and then perform the exercise. Makes it a little bit easier, but you can get to the position where you can activate those muscles appropriately. And then you would go through the same sequence. If that is still challenging and you're having a hard time doing that, a precursor to those exercises is isolating these movements to one side. So what you can do is you can do the same sequence by pushing into the opposite hand, the one leg at a time. Same thing, same hand, same knee. Opposite hand, opposite knee. Hand behind the knee. And then finishing off with that. And you would do that on both sides. And then you would progress to the other exercises that we demonstrated before. Again, these are fantastic exercises to help the body to reinstate those stabilizing muscles, to get the pressure gradients to work, and to be able to get the back to move without as much stiffness or discomfort. One thing that you also want to note, as you're doing those exercises, I had to talk here during that sequence, but you would place the tongue on the roof of your mouth so that you can engage more pressure gradients from the neck to the diaphragm to the pelvic floor. And as you do that, you'll get the benefits of both systems working all together to be able to help your body again. I hope you found these exercises helpful. If you did, please leave us a comment below. And don't forget to like and subscribe. Your potential is within reach.